Now, the Minnesota Department of Health is monitoring one person in the state possibly exposed to the hantavirus. Health leaders say the risk to the public is still very low. Raya Katene has the latest.
This announcement from the Minnesota Department of Health is the first we're hearing of someone in the state being monitored for hantavirus after they may have been exposed overseas to someone who tested positive after being on the MV Hondius cruise.
I think it's a really good sign.
That's right, it's a good sign, says Dr. Kari DeBink with Johns Hopkins University, because it means contact tracing is working.
You want anybody that was in contact with someone who tested positive to be somebody who's being monitored by a health department.
Dr. DeBink's background is in virology.
At what point will I be worried if I see cases that aren't linked to contact tracing popping up in different places?
Even then, she says this outbreak won't evolve into a pandemic like what we saw with COVID-19. She notes that Andes virus is the only hantavirus known to spread person to person, but even then, transmission has only been documented during close, prolonged contact.
This virus is not as infectious as COVID-19, and I think that the risk to the average person is extremely low, just because the only people that have gotten and tested positive for it so far are those people that have actually been on the cruise.
The Minnesota Department of Health also says the risk to the public remains very low. For now, the Minnesotan who may have been exposed is being monitored daily, the department says, and is not showing any symptoms.
Is there any sort of cause for concern?
Obviously, things could change, as the days go by, but I don't think that there's any reason for people to freak out just because we aren't seeing anything that we're not expecting at this point.
Now, Minnesota, of course, is not the only state monitoring someone for potential exposure. We know almost a dozen states now are doing the same. But again, Dr. DeBink says that's not unexpected. It just means contact tracing is working the way it should. Julie.
Thank you, Raya.